Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Leah in here with us this morning. And this is Leah's very first time coming to Advanced Chiropractic Relief. You've seen other chiropractors though before, right?
Yes.
Yeah, and then you came here and brought a lot of your diagnostics and x-rays and everything, which I went over with you beforehand, right?
Yes.
And I just did a history and thorough examination on you. And you told me about an experience that was quite interesting about your medical experience when you went to the MDs for your sternal pain that you were getting. Tell our viewers what they gave you.
They gave me Malox and what was the other thing?
It was an anesthesia that they use at dentists, lidocaine.
Lidocaine, Malox
And
lidocaine.
and you drank the lidocaine and the Malox together, and they call us quacks. Leah has lower back pain that radiates out into her SI joint and down into her right thigh. She also has rib pain that goes around into her sternum here, which has felt like she's, having a heart attack at times. She also has low back pain above her pelvis, which is in her lumbar spine. And she's getting headaches 4 to 5 times a week. She does not have any bladder bowel dysfunction, so we rule all that kind of pathology out before I even do my exam. And she's not taking any medications whatsoever, has no medical conditions that she's being seen currently by a physician, because I don't think she wants to drink any more Malox and lidocaine together. I wouldn't. That's not the kind of cocktail I like. Okay, relax your arms for me. Now I'm going to have you close your eyes, Leah, and bend your head forward and backwards, please. Now see, that kinks up right there, doesn't it?
Mm-hmm.
Yep, now neutral. Keep your eyes closed for just a moment. So the first and foremost thing that I'm seeing with you is that your head is forward in your posture, your biomechanics. Your ears out here over your clavicle. It should be back here over your shoulders. That's why your hands are out in front. You can go ahead and look in the mirror. That's why your hands are out in front of you, because your head's forward and that's pulling your shoulders, rounding them forward. And if you look in the mirror down here, don't move your arms. You see how much space you got here versus how little space you have over here? So your pelvis has shifted laterally on the x-axis to the right. And that's what's putting a lot of pressure on this lower lumbar spine that I showed you the x-rays of earlier, that the discs are starting to wear and tear in there. That's called the degenerative disc disease. Now, there's a big thing going on right now with the Texas Medical Association suing the Texas Board of Chiropractic Examiners, trying to prohibit us from treating patients that have neurological conditions. Pain is a neurological condition. Sciatica is a neurological condition. Headaches are a neurological condition. Chiropractors have been treating those for well over 100 years. So if you guys are watching this, contact the FTC and tell them to put a stop to the Texas Medical Association's anti-competitive actions by suing the Texas Board of Chiropractic Examiners and trying to take our rights and your patients' rights away from you. Because if this thing goes through with the Texas Medical Association, they will have a monopoly in healthcare in the state of Texas. And I don't know about you, but I wouldn't want to be drinking barium and anesthesia drinks for the rest of my life to try to fix these. And so what chiropractors do is we analyze the biomechanical configuration of the spine and human body. We determine whether the patients have vertebral subluxation complexes, which create neuromusculoskeletal conditions. And that's exactly what you have, is a neuromusculoskeletal condition. So contact your government, state representatives and state senators, and tell them to pass the Texas Chiropractic legislative agenda so that we can break free from some of these attacks being put on us by the Texas Medical Association all the time. And you were referred in here by a fellow employee, right?
Yes.
You're a pilot. We take care of a lot of pilots here because we're close to the airport. Let's have a look at you here one more time. You see what you're doing with your hands all the time?
Yes.
I've caught you doing that about 5 times now. Okay, so let's lay you on your tummy again. Like I said, we've already done her evaluation and examination. She's got equal reflexes, 2 plus equal and active upper and lower. She has good strength upper and lower. Now that tightens up in her low back when I bring her legs up. They're even down here, but it's still tightened up there, which is a positive knockless test. And then when I palpate her left SI joint right there, that's really tender, isn't it? And these guys are all sore. That's L5, L4, L3, L1, all the way up in here to the lower thoracics. And you see how she's getting this little increase? Have you noticed you're starting to get a little hump up here? That's from your head being forward. And her neck's out right there on the right there on the right, and right up here at the atlas on the right too. Lock your right leg straight for me again and lift your whole right leg up. I'm just going to show them what a positive sacral deviation test is. Relax that one. Do this one now. Now see, it was more difficult for her to lift her left one up, but this is interesting because most of her pain's coming out of her lower back going down into the right SI joint and glute, right?
Yes.
And down into your thigh even. So I am going to treat her for subluxations in her sacroiliac joints, lumbar spine, thoracic spine, rib cage, and cervical spine. And the treatment that I am going to provide for her is going to affect these neuromusculoskeletal conditions, whether the TMA likes it or not, or whatever they have you believe. They just want to monopolize healthcare in the state of Texas. So we need people from all around the United States to call the Federal Trade Commission and tell them that the Texas Medical Association is practicing anti-competitive actions to monopolize healthcare in the state of Texas. Now, we won a Supreme Court decision back in the early 70s, and you can look the case up. It's called Wilkes versus the AMA, because the AMA was trying to get rid of chiropractors way back 30, 40 years ago. And now the TMA is doing the same thing here in Texas. And we need you guys' support. There, I'm going to put that curve. Remember I showed you lost the curve in your cervical spine on your x-ray? See what I'm doing? I'm putting that curve back in there. There you go. Okay, let's turn you on your back now. Now these adjustments are probably going to be a little different for you from what you've had previously.
Yes.
Because I'm going to be adjusting you on the X, Y, and Z axes. You notice I didn't twist you on your side and try to pop your pelvis?
Yes.
That a girl. Good. Now slide down this way about a ½ inch and put both arms straight out to the sides, palms facing up. Kind of like Jesus on the cross. There we go. I'm going to adjust your shoulders now, your anterior clavicles where they attach to your sternum, and then I'm going to adjust your anterior ribs. You said you were getting that costosternal pain up here, so I'm going to adjust your ribs back into place so that it lines these rib cage bones up where they attach to your sternum. You can relax your hands on your tummy now. Let me have this leg. That a girl. Now you should have felt that from your knee all the way up into your lower back. Good. Same thing here. There we go. Super. Okay, let's set you up face this way. Sideways. There you go. Okay. That's it. There we go. Good. The Federal Trade Commission is the federal government's watchdog, if you will, about monopolistic type of business practices or scams, wrongs to the public, and them trying to prevent patients from coming to see us like Leah is for her pain is unconscionable. Okay, now let's come over here on this table. Remember me telling you your spine was compressed? Well, I'm going to decompress it now manually. A lot of chiropractors use machines to do this. Have you had that yet?
Yes.
You have? Did it work?
No.
No. Well, this is a manual one. You're gonna feel this one. I'm gonna have you lay on your back, Leah, with your butt right here. Head up that way, please. There we go. Okay, on this one, Leah, just breathe through your nose. Keep your teeth together. You don't need to clench them. Just keep them together. Don't bite your tongue. Bring your legs. This is how you start sleeping, by the way. See how your legs are up here parallel with the floor and your head's flat back against the bed? That's the way you should start sleeping, with no pillow on your back with your legs elevated. And she's got reflexes still there. That's good. So, just keep your teeth together. Breathe through your nose. That a girl. Yes, ma'am. Home run. You should have felt that all the way down. Did you feel that go all the way down your spine? Good. Okay, I'm gonna fix your neck here now. Drop it in my hand. Wiggle your left big toe for me. There you go. I got you. That a girl. Boy. A little more aggressive, I bet you, than the other adjustments you've received. You okay? Okay. You're gonna feel lighter when you stand up, and it's gonna take some of that pain away. Now, you will be sore over the next 72 hours, so expect that, kind of like a new workout. You know when you go to the gym? Let me help you up. Turn sideways always. Yep, that's the way you always want to get up, sideways. And let's stand right here in front of the mirror for me again. Okie doke. Let's have you close your eyes and bend your head forward and backwards again. That's already getting sore, isn't it? Yep. Okay, take a look in the mirror right now though. Equal spacing, but your hands are still out front. So this is your homework right here. Lift both shoulders up. Pull them back simultaneously like that. Hold those there for me. Flare these guys here like this. See how it tightens up your whole trap? Now your head's forward and a little left, so we come straight back on the Z-axis to the right. And then, oh, you can spread your feet a little further apart if you need to. There you go. And look at the wall behind you. You're gonna feel a little tap on your atlas right there. And right there. Okay, now relax. Everything. And try bending your head forward and backwards again. Tell me if this feels smoother than the previous ones.
Yeah.
After I did this atlas adjusting instrument on you. That feel a little easier?
Mm-hmm.
Good. Good. So you're a citizen in the state of Texas, right? What do you think about the Texas Medical Association trying to monopolize healthcare in Texas, and you wouldn't be able to come see me directly as a patient?
I wasn't aware that it was going on.
And most Texans aren't aware of that. That's why we're making this public and challenging that.
Well, I think that there's a lot of pilots in general that go to chiropractic care because it is not effective.
No drugs, no
or
surgery.
medical because it's no drugs and no surgery.
Right,
Exactly.
which you can't be taking drugs and flying planes.
Exactly, it doesn't affect our medical, so I think that's a big deal for us. So I don't think.
So, as a citizen of the state of Texas, would you embrace law changes or law clarification in the state of Texas that allows chiropractors to treat neuromusculoskeletal conditions so that the Texas Medical Association is not continually suing us, trying to prevent us from doing our job?
Yes, I think that they need to realize that chiropractic care has been doing that for a long time.
Over 100 years, yeah. And this is the largest drugless, no surgery healthcare delivery system in the world. And they just don't want any of the competition, because when you're coming to see me, you're not going there and drinking your barium anesthesia drinks, you know, and you're not seeing them for your surgeries. And you had an epidural steroid injection. You told me that you had pain ever since you had that injection. That was back in 2015, right?
Mm-hmm.
Good. Well, thank you for sharing your experience with everyone, and let me get on my soapbox here and condemn the Texas Medical Association's actions, which are anti-competitive, by the way, and they're trying to get a monopoly on healthcare in the state of Texas, and only you guys can stop them by calling your state and federal legislators, senators and representatives, and filing complaints with the Federal Trade Commission about antitrust violations here in Texas by the Texas Medical Association. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Leah, who's a pilot here in Houston, Texas. We'll see y'all soon.
Take care.